Who's a good candidate for ICL surgery? Well, typically all myopic patients with higher amounts of myopia. So if you have more than 6 or 7 diopters myopia, you're a very good candidate. In addition, if you have very dry eyes or very thin corneas, you may be a very good candidate even as low as -1 diopter of myopia. And finally, if you have a lot of hyperopia, farsightedness, and are younger than 40 years of age, you also might be a good candidate for an ICL because the range goes up to plus 10 diopters. What are the advantages of ICL surgery? Well, number one is the range of possible correction. The biggest advantage is that you can do ICL surgery from -1 to -20 diopter. So it has a huge range. On top of this, you can correct astigmatism of the cornea. Number two, the ICL probably gives you the fastest visual recovery. So if you had ICL surgery, you will be able to see 1.0 almost perfect vision just a few hours after the surgical procedures. Number three, ICL surgery is fully reversible, which becomes important if you get older. If you age and need reading glasses and you had an ICL, it can be taken out and exchanged for a trifocal IOL, which is not that easily possible with laser refractive surgery. Well, can you have myopia surgery if you have dry eyes? It depends. Myopia surgery basically is possible. However, if you have dry eyes, it is recommended that you rather have a Visian ICL rather than laser surgery. Because laser surgery causes dry eyes for a couple of months, and that will make your situation worse for this time being. So if you have significant dry eyes, my recommendation would be to have an ICL, because there's no side effects such as dry eyes with an ICL. If it's just moderate or slight dry eyiness, it's no problem to have smile surgery. Under what circumstances do we have to replace an ICL? It happens very rarely when your eye really changes significantly for many, many diopters. Then it would make sense to actually exchange the ICL for a different one. Another reason is when you grow older and develop presbyopia, so that you need reading glasses, then you may actually want to go for a replacement of your stiff natural lens with a trifocal lens. Otherwise, it's extremely rare that you have to replace the lens. Can you feel the ICL after the implantation? Well, it is very uncommon. You may feel a little bit of a pressure because it's like a rubber which actually touches your eye inside, and you may feel some pressure for a few days. But as I said, it's very uncommon, and it's not really a pain. It's just a feeling. Can you see the ICL inside your eye? No, you cannot see the ICL inside your eye. It takes a microscope, as we use it when we examine your eye. Otherwise, it will not be possible to see the lens. What about your vision immediately after surgery? Well, typically, immediately after surgery, your vision will be slightly blurred, regardless of what you are doing. If you had SMILE, or if you had an ICL, or if you had lens exchange with a trifocal IOL, during the first hours, vision is typically blurred. That is nothing to worry about. It will go away. Typically, the day after surgery, you are able to function. After all these procedures, you will be able to drive and see sufficiently to do everyday tasks. However, perfect vision may take a few days or even a few weeks, but it will come. Well, I was looking at patients who had a correction of -5 diopters of myopia, and I did compare how laser surgery, such as SMILE, performs compared to ICL surgery. Basically, the result is that the differences are very, very small. However, for really the best possible quality of vision, the ICL actually provides a little bit of an advantage over refractive laser surgery.